Welcome to Ready to Work. We are excited that your career journey has led you here. We've designed this Ready to Work program to prepare you to start work as a healthcare professional in as little as 2 to 4 weeks at absolutely no cost. Now that you've taken the first step in the application process, make sure you're officially enrolled. Complete the zero-cost enrollment and you'll be on your way. Our Ready to Work career training program will take you from the classroom straight into a job. We've teamed up with local employers to help build their healthcare team with new candidates just like you. With great pay and fantastic benefits, landing a job with our partner employers will be as easy as 1, 2, 3. Step 1. First, you'll complete the online job training to learn the foundations you need for success in healthcare. The online training has been set up to be completed anytime, anywhere, on your schedule. Step 2. Once you've completed your online courses, you'll be ready to start in-person labs. All you need to do is sign up for lab sessions held in your area. Our seasoned instructors will take you through a variety of exercises to ensure you gain the hands-on experience required to start your new job as a practicing medical assistant. In addition to attending live labs, you'll also have the opportunity for more practice through our virtual simulators. Step 3. You made it. Now the easy part. It's time to build your new resume to show Ready to Work employers you have the skills they're looking for in new hires. We'll walk you through every step to ensure you're ready to put your best foot forward and get started in your new career right away. Our learner support team is available 24/7 to help with any questions and assist with national certification and a certificate of completion from our university partners. With Ready to Work, you have everything you need to start your new career in healthcare. So what are you waiting for? Let's get ready to work. Hi, everybody. We're so glad you're here today. My name's Katie Garcia, and today I'm here with Annie Steiner, Trinity Health IHA Talent Acquisition Manager. We're so glad you guys are here. So what I'm going to do today is I'm going to give a quick overview of the Ready to Work program, and then we'll dive into a Q&A with Annie. So we have some questions prepared that we've gotten a lot from our learners that we're going to go over, and then we'll open it up so you guys can ask questions as well. So first, we'll jump into the overview. So with Ready to Work, our mission is simple. We really want to provide an effective solution around skills achievement, career services that really connects learners to jobs. So it's not just about getting that education piece, and it's not just about finding the job, but it's connecting those two pieces so you know what you're working towards. And so our the Ready to Work program, it's completely free. It's a pre-employment screening and qualification program. It's provided by Auburn University and powered through Campus Ed. So some of our learners, it takes them about 2 weeks to get through. Some it takes a little bit longer. It just really depends on your schedule, what you have going on in your life, and when you can fit the training in. And so one of the questions we get a lot is, is the program really free? It really is free. You'll never see a reimbursement from us. You'll never see an out-of-pocket expense. You'll never see a tuition bill. Everything in the program is covered. So that means your e-learning, enrollment fees, your materials, your labs, your lab supplies, your certification tests, the job placement, resume help. It's all included. The only thing that you need to do is complete the program, and we are here to help you every step of the way. So from here, let's jump into our Q&A with Annie Steiner. As I mentioned before, she is the Trinity Health IHA Talent Acquisition Manager. So once you complete the program, either her or someone in her same position is going to be who you'll get to interface with first. So Annie, we are so thankful you're here for us today. Thank you so much for taking the time out to be with us. IHA, you guys are a premier partner with so many different career opportunities. Do you want to tell us a little bit more about Trinity Health Systems IHA? We'd love to learn more.
Yeah, thanks for having me. I'm so excited to be partnering with you guys. So IHA was established in 1994, so we've been around for a little while. We're a multi-specialty physicians group. So we are all doctors' offices, clinics, outpatient. Um, but we are affiliated with Trinity Health, so we joined in with an affiliation with Trinity Health about 15 years ago or so. And some of our doctors do round in some of the Trinity Health hospitals, but for the most part, we're all office based. So we have all different types of areas of medicine from primary care, pediatrics, OB, all different types of specialty offices, all kinds of surgery offices, and then about 13 urgent care.
Wow. So you guys you run the gamut of in terms of like opportunities, different types of organizations, different types of offices. That's really neat. And since we've been working with you, we've really noticed how good you are at your job. You're really good at spotting talent. I know you also are really good at identifying really good talent and then opportunities they might have for, more training and stuff like that. Can you tell us a little bit more specifically about your role at IHA?
Yeah, so as you mentioned, I'm the talent acquisition manager. I've been here about 8.5 years now with the company. And I work specifically with the MA externship programs, our apprenticeship programs, our extern programs. So really building partnerships with our area schools, specifically in medical assisting. And then I also oversee a team. So our talent acquisition team, we have 3 specialists, a supervisor, and then 2 employment specialists. So combined, they do all of the recruiting, interviewing, offers, and then the employment specialists are kind of doing more of the onboarding, background screen, orientation process. So we have a great team here.
Wow. Yeah, it sounds like you guys have a lot of people working behind the scenes to make sure everything goes as smooth as possible. And with Ready to Work, we really designed it, to meet learners where they are and provide a zero-cost path into a career in healthcare for those who might be looking for a career switch or just even a new career path. Tell us why you guys at IHA are excited about Ready to Work.
Yeah, so I think you guys are a great partner helping us attract people who are excited about the medical field, maybe helping people that, are not financially able to do this on their own or never thought that they could, go into the medical field for whatever reason. And of course, they're ready to work when they're done. So there is such a shortage of medical assistants out there. And so we're really just interested in getting the word out about this great opportunity and great field.
Yeah, and one thing that we've been really excited about is really being able to form that connection to when our learners are done with Ready to Work and then connecting them directly to your organization. How is this program different from how you guys normally hire?
I think, some of the programs are a little bit longer of a commitment. Whether it be a certificate program that's more like 9 months or a 1 year program at like a community college or something like that. So this gives, students the opportunity to get through the program at more of a self-paced, and then also, be job ready at the end. So
That's great. That's great. Yeah. And that's the one thing that why we designed it too, is like we knew if somebody didn't have time to commit to a 1 or 2 year program, this was a great option. As we mentioned before, some of our learners get it done in 2 weeks. Some of them it takes a little bit longer, but definitely, by that 8-week mark, most people have flown through and done a great job with, job skills that they need for on the job. They've passed their national placement exam, so they're really ready to work.
right.
So, so we're currently working with you guys on training for the health systems medical assistant. Um, can you tell us a little bit more about the roles IHI is hiring for, what that entails, and then also, what does the career path look like at IHI?
Yeah, so we've actually done a lot of work here at IHA around the MA career path because it is so important for us, for people to be able to grow in their career with us.
Yes.
So we have a medical assistant role. We have both non-credentialed or credentialed.
Mhm.
It sounds like once they're done with your program, they are able to take that national credential, which is
Mhm.
great, great opportunity, and does give a lot more growth opportunity as well. So we have different stages of the MA career path, and then we also have, other opportunities that if people are more interested in, like a supervisory role, being in a clinical coordinator position. We've had MAs that have worked their way to a practice manager. We've had MAs that have come here to our central office and helped with our IT team doing the training for our electronic medical record systems and things like that. So even if people decide they don't want to keep following that clinical in-office field. We have more administrative things as well, kind of behind the scenes, not as much patient facing.
Yeah. Well, I think that's great to know, because I think we all want to know that if we start something, there's either opportunity for growth or opportunity to take a different path. With you guys being such a large organization, it really sounds like the opportunities are really endless once you get in and you get going.
Yeah, we do a lot of promoting from within and hiring from within. So.
Yeah. That's great company culture. And of the hiring and things like that. We know you guys recently hired Camaria, who went through Ready to Work, and she's currently working in a pediatrician's office. And that really worked for her based on her location and the type of office she wanted to work in. Can you talk a little bit more about job placements, what different opportunities you guys have for that MA position?
Yeah, so we have over 150 locations
Wow.
actually. We're in a 6 county radius here in southeast Michigan. A good majority is kind of in the Ypsilanti, Ann Arbor area, but we're pretty far reaching into 6 different counties. And then, like I mentioned, we have all different types of areas of medicine. So, if you're more interested in urgent care and need a little bit more flexible hours or evening, weekends, different specialties, different surgeries, or, your primary cares. So we have pretty much anything that you would have an interest in, or hours to meet your needs. We have full-time, part-time, and contingent opportunities.
Wow, and it really sounds like too, based on your guys' locations, that if you're in one part of the city, you guys most likely probably have some type of office near you.
Right,
Um,
exactly.
yeah, well, that's great to hear. And I know one question we get a lot about is, tell us a little bit more about the benefits. We'd love to. Can you let our viewers here today know about the benefits with IHA?
Yeah, so we have, pretty competitive benefits. We have a full benefit package with medical, dental, vision. We have a retirement plan with matching. Um, we do have the tuition reimbursement. If someone decides they want to continue on in their education, they can definitely use that. All of our locations have free on-site parking, so you don't have to pay for, monthly parking or annual parking.
Oh, great.
We also, upon hire, anyone who needs scrubs for their role gets 2 free sets of scrubs. And then on an annual basis, on your anniversary date, you also get 1 free pair of scrubs.
It's important to have those, definitely.
Yes.
Yes.
Our paid time off is very generous. In your first year, you start at just over 3 weeks per year. And then we have several different tiers. So the longer that you're with IHA, the more paid time off that you accrue. And then because we are part of Trinity Health, we do have a lot of other perks as well, such as cell phone discounts. If you're buying a car, we qualify for one of the car buying plans. So there's a lot of, different perks as well.
Wow, it sounds like you guys have a lot of opportunities. And so how long do you need to be employed before your benefits start kicking in?
Actually, our benefits now start on your first day, so there's no waiting
Wow.
period at all.
Wow, that is amazing. That's not something you normally hear, so that is great. Well, thank you for sharing those. So my next question is, so once our candidates make it through the program and they've passed that national exam, which again, Ready to Work helps prepare you for with practice tests and things like that. Annie, can you just walk us through what the hiring process is like?
Yeah, so typically we would have you visit our website, see, the position that you think would work best for you based on your area of interest, based on your location, how many hours you're looking for. From there, somebody from my team or even myself would reach out and schedule a time for a phone interview. After that, we would send you on to one of our offices to interview. Sometimes they'll even set up a time for you to shadow just so you can really see the role, see the office, see the environment, the workflows, things like that.
Yeah, and then on our end too, just so the candidates and learners know, we'll have a special link that we send you guys once you're ready to apply. So you guys, we'll connect you right with IHA and Annie and her team. So after you've completed the program, done your labs, done the tests and things like that, that's when that connection point will happen. I'm going to, at this point, Annie, I wanted to ask you, is there anything else you think is really important that we didn't touch on today, or anything else you wanted to add?
I think just to kind of reiterate, that we're excited to have this partnership. We're excited to bring on new medical assistants to help with our needs at our offices,
Yeah.
and really just, provide that quality care to our patients.
Yeah, no, that totally makes sense. And as we've said, we're really excited to be partnering with you guys as well. And as you mentioned, there's definitely a hiring need right now for the medical assistant position. And from here, we're going to give a couple minutes for questions. So if you guys who are watching, definitely type your questions in and we'll get to it. And we have a couple questions. We have one question that just came in that says, do we have to be in Michigan to take part of this program? So Ready to Work currently, we are in the Detroit, Michigan area. We are going to be launching different locations soon. So make sure that you follow us on social media, and we'll announce when we have other cities. But it is important that you are in that Detroit area in order to be a good candidate for IHA. Thank you so much for that question. Let's see what else. What other questions we have coming in from you guys today? And we do have a team on the back end too that's kind of giving us some important information. So I might let you guys know when I see information. All right. Okay, so we have a question that just came in. And the question is, what's the minimum age to start? I'm 17, but I graduated high school in 2021. To start the Ready to Work program, you can go through that program at any time. But Annie, I'll let you answer on the IHA side for hiring age.
Yeah, I think technically the job description does say high school diploma. I don't know that there is a specific age listed on the actual description, but I think that we have in the past had some people that were kind of borderline and were able to move forward. So probably just something more to look into if we were to get to that point. But that's great. You already graduated.
Yeah. Yeah, congratulations on that graduation. So we would say get into the Ready to Work program, complete it, and then we can go from there. So we had a couple other questions come in. Can we pick training days? So for our labs, yes, we have signups going out all of the time. So you can pick different times if you want to do your labs. Most of the time they're on the weekends. We're working on opening up other dates and times. So just make sure you're on that sign up list and you can pick. Okay, we have a lot of questions coming in. Okay. Okay, how soon can we start training? So in terms of Ready to Work, you can start the program if you sign up for Ready to Work today, you can start it today. So get in there and start going. Once you start that online coursework and you get in there, you can actually sign up for labs as well. So you can do your labs and your online coursework in tandem. So really you can get going right away. Let's see, what's our next question? Are labs at a schedule and or a place? So our labs are in the Detroit area. And there are certain times you can sign up for because we have really amazing instructors who do those in person with you, and you're going to be so excited to learn from them. And in addition, you'll have other people from Ready to Work who will be doing the labs with you. So you'll get to meet some of your same peers who are also in the program. So let's see, what's our next question that's coming through. All right, I'm seeing, is there anyone that I can speak to on the phone with someone from Ready to Work? Our learner support team is happy to answer questions. And you can contact us at readytowork@campused.com. And from there, we can get in connection with you to make sure we get all your questions answered. And it's readytowork@campused.com. If you're enrolled or if you need help with the program, we have that learner support team ready to assist. And then I just got this info from the team too. If you're already enrolled in the program, there's a learner support link in the course. So you can find that when you're actually logged in. All right. So the next question that we came in from Shayla, and it's, as a medical assistant, do you have to be vaccinated or no? So Annie, do you want to talk a little bit about IHA's policy on that?
Yeah, so we do have certain requirements for vaccines upon hire. We do require an annual flu shot as well as a COVID vaccine. That is a Trinity-wide requirement for us.
Great, thanks for sharing. Yeah, and just this could vary depending on different health organizations, but for IHA, that is their requirement that Annie stated. All right. Okay, so we have a question from Rebecca. She said she hasn't gotten any emails about lab signups. How do you sign up? So you should get a lab notification, and there'll be links to sign up. And they're sent out depending on where you're at in the program. So if you've just started, it'll be a little bit before you get that link. So make sure you work on that online course material. And then if you have other questions while you're in there about labs, make sure you can contact that learner support area. And then we also recommend you get about 30% through the online course content before you sign up for labs, because that's going to help inform what you're going to be learning on the labs. So after you get through that second quiz, that would be a good marker. Let's see, what else we got coming in. Okay, so she said, I enrolled the other day and I received this email about coming to this live today. Who should I contact? So you should be getting an email from learner support. We're super glad you're in the program. And you can also contact us at readytowork@campused.com. Thanks for that question. Let's see if we have any. And that's where that email has come from. So let's see if we have anything else coming through. Yep. And I had one more thing come in from my backend team, and they said, so that email that came through, that will give you the link to the online site where you can access the course. Okay. So we have another question that I'm going to ping over to Annie, which is, does IHA accept medical or religious exemptions? Which I believe is in question to the vaccine.
I would assume as well. We do have both a medical and religious exemption. It does go up through a committee at Trinity Health for review and approval process.
Great. So, most other healthcare organizations are also similar processes in terms of IHA, in terms of requirements and processes. So IHA is definitely not alone on this in terms of their requirements and processes. So Autumn had a question coming in, and she says, once the online training is complete, when and how do we get set up for the national certification? So once you complete that program, national certification exams can be scheduled by our team on your behalf. So again, we're here to help you every step of the way. And in addition to, we'll have our practice tests and different things that you can go through. And then Annie, on that topic, can you speak to non-certified versus certified in the hiring hiring process in terms of do you have to be certified to get hired, and how do you guys work that out?
Yeah, it's not an absolute requirement at this time. At one point, it was part of CMS guidelines, which has to do with insurance payment and stuff like that, but it's not a requirement right now. So we do also hire non-credentialed MAs. We do have a different salary range, whether you're credentialed or non-credentialed. So if you do have that credential, it is a one level higher salary range. And then, like I mentioned earlier, there is more of a career path growth opportunity to get to those, MA3 levels or clinical coordinator levels, things like that, if you do have your credential.
Okay, that's great to know. And on our side, if you do go through the whole program, we feel very confident that you'll be able to pass that national certification exam. So thanks for that information, Annie. Super good to know. And then we had a question coming in on the starting pay for that medical assistant position, and I believe we had it on the benefits slide. Are we able to pull up that slide again, team?
Yeah, the starting rate for the non-credentialed MA is $17 an hour for credentials. So if you finish and already get your credential, it would be $17.50.
Okay, great. That's great to know. And then I'm reading some of the information from my team. So as Annie stated, you can start non-credentialed, and then can you work into that credentialed role as well, Annie, I assume?
Yes, and we do also reimburse. I think that's maybe part of your program too, but
it is, yes.
Okay.
Yes. But it's good to know too that you guys reimburse too, because you said sometimes people, if you start as a medical assistant, you can work into other more specialized roles, correct?
Right. And depending on the credentialing organization, sometimes they have annual fees or annual dues or something like that you have to pay. And we do reimburse for those as well, which I don't think a lot of companies do.
Yeah, that's great to know. And it's also, good to know there's options too. And on our end too, on the ready to work side of it, if you've made it through the program, but you haven't had a chance to take your national certification, it's great to know that you can get ready to work right away with IHA even if you're in the process of taking your national certification. So we have I think I see another question popping through. She said, I'm a certified patient care technician currently working in the medical assistant position. Would I still have to go through the entire program? So if you already have experience in the role, we don't need to verify. We would just need to verify your particular skills at this stage. And then Annie, I don't know if on the IHA side, if you guys have run into that before as well.
So patient care tech can sometimes be different than a medical assistant. It seems like people use them in very different like skill sets. So some of them, might be very similar and have a lot of overlapping, and some might be completely different than what a medical assistant does. If you are working in a medical assistant position, we do also consider experience. So even if you haven't gone through a school program, if you have the medical assistant experience, we can a lot of times consider that as well.
Yeah. So on this end, I would say, reach out to us. We have the email, and we can discuss like how best to make sure we can verify your skills, whether that's through assessments or it's through labs and different things like that, to make sure we get you in the best place possible. And then if you do have those skills, we could connect. We'd be able to connect you with IHA. So I would definitely say reach out to us and see where we can best like place you. Okay, so we had another question that came through. So just how do I get verification that I am enrolled? So you're gonna want to go to our website, which is scrolling on the bottom, readytowork.edu2.com. So you'll go through that enrollment process, which shouldn't take you more than, a couple minutes. And once after that, you'll receive an email confirmation as well as a welcome letter. And you also should be able to log in. So look for all of that content from us. And then if you still have questions, you can reach out to us. But you can always go, back to the site to double check everything. Click the My Courses in the top right-hand side, and you should be able to see that information on what you signed up for. So go check there. If that doesn't work, definitely reach out to us. And you'll use that account you created during the registration process. Great question. Let's see, what else we got coming through? Do we pay for the certification test? So that national certification test, that is part of that's included in the Ready to Work. So all your exam fees are at zero cost to you. And as Annie mentioned, IHA, if you take other exams and stuff in the future like that, they'll work with you on those as well. The next question is, do we have to pay for anything? So the answer is there are no costs for our candidates who participate in Ready to Work. So your program fees, your lab supplies, your course material, all of those things are completely free, zero cost to you. I think my team, they might pull up a slide. If you guys want to pull up that slide of everything that's included in the program, we can go over that. So your ebooks, course materials, help with your resume, national certification, background check, job placements, lab supplies and materials, your hands-on lab training, it's all included. So the only thing that, you really have to do on your end is, commit to the program, stay motivated, and complete that coursework and labs. And then from there, we connect you with IHA. So no costs. It's really amazing. So really encourage you, if you're even, thinking about it, definitely go ahead and sign up, start working through it, because it's just such a great opportunity that if you're even just thinking about it a little bit, we would encourage you to sign up and really go for it. There's really, really no risk. Let's see if we have anything else coming through from our viewers today. You guys have had some really, really great questions. It's been super exciting to, hear from Annie today on her side of things, so we can really put that job opportunity into perspective, because it's there. They're waiting for you. So we had another question coming through. How long is the program? So the program timeline is really, it's designed to be worked at your own pace. So some of our students and learners, they're done within as little as 2 weeks. Some of them, they might take up to 8 weeks, just depending on what you have going on in your life. If you're working full time, if you have family commitments, different things like that. So if you say like, hey, I have an hour during my lunch break where I'm going to get on and do some coursework, that's totally fine. If you do it in the evening, that's fine too. And then you'll just find those times for your labs, and then you'll be all done. Okay, so we had another question come through. Once we complete the online course, then do we contact you guys for job placements, or do you guys automatically reach out after completing? So as you work through the program, we'll be in touch with you. So we'll begin reaching out as you're working through the online material to help you schedule your labs. And then as you complete the remainder of the program, you'll hear from us. We have different checkpoints built in, and then we'll also reach out to you for job placement. So we're really here for you every step of the way. And it's important, like, as I said, we have those checkpoints built in. So it's important that you guys hit your checkpoints, and then that will help you move through the program and get to the next steps, and hopefully the final parts. So we can make sure that we feel confident that you're ready for job placement and ready to be passed over to IHI and Annie's team. Okay, so we have one more question come through, and I'm going to let Annie speak to this, which is, how does the $3 shift differential work?
So we have different shift differentials depending on where you work. If you're working on the evening or weekend, the offices have different shift differentials in our call service center, and then also our urgent care for their day hours, as well as evening and weekend hours. They have different shift differentials as well.
Okay, great. And that's probably something too that you guys can talk about once you made it through the program and you're in the hiring process.
Right, exactly. Depending on the role, if there are shift differentials that apply, then we would definitely make you aware at that time.
Perfect. And then we had another question come through, if the training is paid for or not. And while you're going through Ready to Work, that training portion is not paid for, but it is completely free. A lot of some of our learners and candidates, as they're going through the program, they're actually continuing to work if they're doing that as well. So it's really designed to meet you where you're at. So if you're working, you can also do the program. And then from there, we'll help connect you to your new career in healthcare. Okay, so we had another question come through. When the other programs open, can we take those classes too? So right now we're currently just hiring for the medical assistant, but we will have more programs opening up in your area, such as pharmacy technicians, dental assistants. So once those are available, we'll let you know, and we'll do some Facebook Live sessions, YouTube Live sessions, as we have more information for those, and more information for those hiring and employers and stuff like that. And then we have, can you leave the link I can share for others to apply? And definitely we will leave the link in the comment, and we'd love it for you to share with friends, family, or anyone else who you think might be interested as well. Let's see if we had anything else coming through. You guys have had some really, really great questions today. Let's see, we'll give everybody maybe another minute All right. Okay, so we had just one more question that came through, wondering if the training is paid training. So the training is not paid, but it is completely free. So it's free to all candidates. So you don't have to provide tuition or anything like that. It's all covered in the cost of the training. But once you complete the program and you get hired on, that's when the paid job would start. All right. Well, thank you, Annie. I just wanted to say thank you again for being on today. You provided so much great information about what it would be like to work at IHA, the different opportunities, the opportunities even for career development, after, hiring and things like that. We're, again, so honored to be able to work with you guys on Ready to Work and hiring and things like that. So again, thank you guys. Thank you so much. And I know we'll talk to you soon.
Thank you, everyone.
Yeah. Thanks, guys. Welcome to Ready to Work. We are excited that your career journey has led you here. We've designed this Ready to Work program to prepare you to start work as a healthcare professional in as little as 2 to 4 weeks at absolutely no cost. Now that you've taken the first step in the application process, make sure you're officially enrolled. Complete zero-cost enrollment and you'll be on your way. Our Ready to Work career training program will take you from the classroom straight into a job. We've teamed up with local employers to help build their healthcare team with new candidates just like you. With great pay and fantastic benefits, landing a job with our partner employers will be as easy as 1, 2, 3. Step 1. First, you'll complete the online job training to learn the foundations you need for success in healthcare. The online training has been set up to be completed anytime, anywhere, on your schedule. Step 2. Once you've completed your online courses, you'll be ready to start in-person labs. All you need to do is sign up for lab sessions held in your area. Our seasoned instructors will take you through a variety of exercises to ensure you gain the hands-on experience required to start your new job as a practicing medical assistant. In addition to attending live labs, you'll also have the opportunity for more practice through our virtual simulators. Step 3. You made it. Now the easy part. It's time to build your new resume to show Ready to Work employers you have the skills they're looking for in new hires. We'll walk you through every step to ensure you're ready to put your best foot forward and get started in your new career right away. Our learner support team is available 24/7 to help with any questions and assist with national certification and a certificate of completion from our university partners. With Ready to Work, you have everything you need to start your new career in healthcare. So what are you waiting for? Let's get ready to work.